So this week we've got kind of finishing stuff up in lab over the digestive system. I finished the digestive system this week. We're going to have our lab test in lab next week over respiratory and digestion. Okay. And then I think we said what the following week is then respiratory, digestion, and metabolism. No, just digestion and metabolism. Okay. I got it right on the board anyway. So when you have lab, I'll show all that to you. We're kind of making our way down to the stomach, and we talked about, hopefully last time, that there were some circular and longitudinal smooth muscle that was in this tube that's going to be smooth.
So you wanted us to remind you about the test they changed for the lab.
Oh, so I want to thank you. When we take our final lab test, I would like for us all to do it on that Thursday so that everybody, I'm going to keep asking the Tuesday group, can everybody on the Tuesday group take it on that Thursday? Okay, that way we'll just all take it, and that gives you Tuesday to come in also. Everybody can come in Tuesday and check, okay? So, and keep reminding me, thank you, Hope. You rock, I don't care what everybody says. I like you.
I'm making it in life now.
Okay. So peristalsis is going to be the process that is going to be utilized from now on. Okay? Once we swallow, once we get it past that first 1/3 of the skeletal muscle that's in the esophagus, we're going to hand it over to the autonomic nervous system with smooth muscle, and it's going to deal involuntarily with moving it down. So it's going to be under the nervous system control to a degree. Okay? But we don't have to think about it, right? It's not anything that we have to worry about. Okay? So, peristalsis is that process of using circular and longitudinal smooth muscle. The arrangement is the circular smooth muscle is close to the lumen. The longitudinal smooth muscle is on the outside of the circular. Okay? Which allows us to do a squeezing and a pulling, like if you're, we said last time, if your shorts get sucked up in your gym. The string gets stuck up in your gym shorts, headed backwards. Or your sweatpants or something like that. If you lose the string and you got to get it back, you sit there and do squeeze and pull, squeeze and pull, squeeze and pull, which is what peristalsis is doing. Okay? So we're not going to have to think about it, and it's going to slowly move along. In the esophagus, where it's all squished down, we looked at it last time, where it was all squished down, it's very easy to see how that's going to occur. As we get more into the stomach, the small intestines, it's going to be much more fluid that's there. Tons of fluid are going to be moved into this tube. So instead of it being really easy to squeeze and pull, it's going to be kind of sloshing it along. Okay? If that makes more sense. Okay? Because it is very fluid. There's going to get to be able to be some movement back and forth. But the nice thing is we get to continue to stir it as we're doing this, and that's what part of peristalsis' job is to keep everything in solution. All right, so from the esophagus, we're making our way down into the stomach. Stomach is a big vat, a big holding tank, and a lot of times this is what students think is probably the most important of our organs in the digestive system, the stomach, but really it's not. We don't really need that much. Okay, we can cut a lot of this out nowadays for weight loss surgeries and things like that, right? So it is good for holding on to it. If you take a bunch of it away, you have less to hold on to, so you have to eat a lot more small meals. Okay, so they've got belts and they've got bands and they've got all kinds of things to decrease the size of the stomach for weight loss. Okay, and they can actually do gastric bypass surgery on this now. So the goal here, the function of the stomach, store the ingested food. Lots of organisms go out, eat a bunch of food, and then go lay down and digest it. Okay? Like if you're one of the big cats out on the Serengeti, you may get an antelope, you eat the entire antelope and then go lay up for 3 or 4 days while it digests. Okay? Protein's going to take a while, right? So, the stomach is also there for mechanical breakdown in that it's going to be smooth muscle as well, and it's going to knead and churn and flop this all around. Okay? So it's going to do mechanical processing. It's also going to do chemical digestion. We're going to put a bunch of enzymes into this stomach, and we're going to put a bunch of hydrochloric acid into the stomach to help us break bonds. Okay? And the last thing it does is kind of something that's way outside of our thinking, in that it produces a chemical, a glycoprotein, that is going to be important in us absorbing vitamin B12 in the small intestine. So without this, and vitamin B12 is often a shot that you get at the doctor's office to make you feel a little better, to make everything kind of work on your metabolism, work on a whole lot of different things in the body. Okay? So a lot of people don't, depending upon their diet, how this is functioning, get enough B12 in the diet. So this is what the stomach looks like. It is a big C-shaped, almost like the nucleus of a monocyte. You can see the esophagus coming in. Above is the diaphragm. Okay, and so it punches a hole through the diaphragm. We can see the liver over here. The part that sticks up is called the fundus of the stomach. The part that is around the esophagus coming in, that's called the cardia. The main portion of the stomach is the body. Okay, and then it narrows down into this area that is the pylorus, and it really terminates at another sphincter that is called the pyloric sphincter. Mustache area. Okay, there is a sphincter up here called the cardiac sphincter or esophageal sphincter. You call it either one. Its job is to, once the food makes its way into the stomach, that's supposed to hold it in place. Okay, a lot of people suffer from gastric reflux disease, where that's a leaky valve now, where if you lay down after you have eaten, there's still a lot of hydrochloric acid in the stomach that can leak into your esophagus and cause that burning sensation, heartburn, that kind of stuff. So, the valves are there, the sphincters are there to hold things in place while the stomach does its job. Okay? The outer portion here, the big portion, is called the greater curvature of the stomach, and then the lesser curvature is this smaller area on the inside. And it changes shape quite a bit. We see drastic differences in the shape of the stomach. We can stretch the stomach out after big meals. If you go through a process of eating a bunch of smaller meals, the stomach actually decreases in size. Okay? Greater curvature, lesser curvature, what this talks about. Size varies, and it's located just below that liver and diaphragm, more on the left side. Okay? 4 parts to it you got to know, and you need to know those for lab. Okay? There are the muscularis mucosa and the muscularis externa that are going to do most of the work here. Okay? The mucosa is the bands of muscle that are associated here, close to where the gastric pits are, and then the muscularis externa is the farther ones out here. That's where the circular and longitudinal smooth muscle is found. Okay? So, not only is this going to do mechanical processing with this, okay, we're going to have digestive enzymes being produced, and the structure that we look for is this structure here, which is called the gastric pit. Okay? Now when you look at the surface of the stomach in lab, we see the gastric rugae on the inside surface, those hills and valleys. So this is part of that mucosa of the stomach itself. Okay? So the lining of the stomach, where the mucosa is, has a bunch of pits associated with it. So it is invaginations down into. Okay? We're going to have these pits that make their way down, and they're glandular down here. We've got some neck cells up here, but most of the glandular cells are down here. Okay? And so think about them as shallow depressions that are moving down. We've got different kinds of cells, mucus-producing cells, parietal cells, chief cells, even G cells producing gastrin. Okay? So when we fill this tube up, ultimately the the stuff that is produced makes its way out onto the surface of the stomach where the food's at. This is how we'll have access to the enzymes, the hydrochloric acid, and that kind of stuff, making its way and mixing with the food, okay? So, circular smooth muscle here, okay, longitudinal smooth muscle here, and we even have a band in the stomach, an extra band of muscle that are called the oblique muscles, okay? And this is set up the same way our muscles of the abdomen were set up, remember? We had those that went across, we had those that went up and down, and we had those that were oblique. And that gave us 3 different ways to squeeze, right? All kinds of different movement. It's the same thing here. This gives us a tremendous amount of mobility or motility in the stomach because we're able to move it around, move the food around. Okay. So these gastric glands, okay, especially in the fundus and the body of the stomach, we're going to see tons of these, and they move fairly deep down into the lamina propria, that connective tissue boundary underneath the mucosa. And we've got one pit with several glands that attach to it that it shows. You see 2 different glands attached to this pit on the picture that you can see. Okay, and we see that the gastric glands are going to secrete hydrochloric acid. That's going to come from the parietal cells in the pit. Up at the very top, we get some mucus neck cells that secrete a little bit different kind of mucus than what we see with goblet cells. This is one that allows it to buffer the damaging hydrochloric acid, so it's going to kind of smear over the surface, this mucosal lining, with this mucus, and it's going to be protective, okay? If we lose too much of this acidic mucus that's there, we can have an ulcer, okay? And that's what some of these bacteria are known to do now.
I'm sorry, may I ask a question here? You said, looking at this slide, what you have there is the gastric glands, and you have fundus and body of stomach. So, does it mean that the fundus and the body are part of the gastric?
Have the most gastric pits.
So they are gastric pits. So are you saying that the fundus and the body, they both produce the hydrochloric acid?
Because they have the gastric pits.
Okay.
Yep. Okay. That's where most of them are. Okay. So lots of parietal cells in these pits that are going to produce the hydrochloric acid and that intrinsic factor that we talked about that allowed for us to absorb vitamin B12. We've got chief cells as well that secrete pepsinogen. Pepsinogen is for breaking down proteins. Okay. If I ask you to go get me Pepsin, what would you give me? Go to Kroger and get me Pepsin?
Pepto-Bismol?
No.
Pepsi.
That's what everybody thinks. It would be meat tenderizer because that's what we're going to use to start breaking down proteins. Pepsinogen is all about a precursor like fibrinogen was when we created fibrin. Pepsinogen gets converted into pepsin with the hydrochloric acid, and now we finally have something that starts breaking down the protein. Okay? But yeah, it sounds like Pepto-Bismol. I get it every class. Pepto-Bismol. Okay? So, pepsinogen in the presence of hydrochloric acid converts to pepsin and we start breaking down the proteins. And then we've got these enteroendocrine cells. Now, these are going to be cells that are going to produce local hormones that have an effect on things in front of and behind where that organ is. Okay? And what I'm saying is, if we're working with the stomach, we may need to prep the small intestine where the food's going next to get ready, right? And there may need to be some backtracking from the small intestine to communicate with the stomach. Okay? So we've got a lot of these chemical signals that are going to be sent around. Okay? What is histamines going to do? We know histamines will help dilate blood vessels, right? So why are we dilating blood vessels? Well, we're going to start absorbing things we need to move it in the bloodstream. Okay? So, And at this point, I should say there is limited absorption in the stomach. If you are lipid soluble, it's not going to stop you, right? That stomach wall is not going to stop you from moving from inside the stomach, where the lumen of the stomach is, into the cells of it, because if you're lipid soluble, you go right through the cell membrane, right? So what would go right through the cell membrane that would be lipid soluble here? If you're lipid soluble, there's one thing that, okay, that Lacey probably drinks a lot of wine at home, right? She's talked to me, yeah, alcohol. Right? So she's married to a trumpet player, right? Trumpets and that, you'd have to drink wine if you're married to a trumpet player, right? So, this is where alcohol can get absorbed. Now I'm saying can because if you're doing it right, what do you do when you're drinking alcohol? You're also consuming food. Okay? You want to eat before you go out drinking, right? And that gives the alcohol a place to absorb into the food so that it doesn't move directly into your tissues, right? If you go drinking on an empty stomach, how's that going to go? That makes you a very cheap date, y'all. So, you know, you should not do it that way. Remember that alcohol is the #1 date rape drug. Okay? So, if we're trying not to get drunk, and I'm not saying anything about that, right? That needs to have food in the stomach to absorb into as well. Okay? Okay. So, here's the action of the stomach. So those 3 bands of smooth muscle, longitudinal, circular, and oblique in the stomach, okay, allows us to do this kind of a movement. Okay, this kind of a movement. We're going to knead it. It's like making bread. Okay, we're going to knead it, churn it, twist it. We can move it in all possible angles based on the muscle contractions in the stomach, so we get to mix this very well. And what we're mixing is those enzymes, that hydrochloric acid. We still got enzymes working from the mouth, from salivary amylase, from lingual lipase. All of that's working. Okay? And once we have had it in there long enough, we can test it by opening that pyloric valve and sending it to the small intestine. And the small intestine can give us some feedback on how well we've done. Okay? So let's say we've got a bucket. We've got a big 5-gallon bucket here, and we put all kinds of different sizes of rocks into this bucket. Okay? From sand down to great big pieces of gravel. Okay? And we take this bucket and we shake the bucket. We sit here and we shake the bucket. What size rocks or stones are going to make their way to the bottom?
The smaller ones?
The smallest ones, right? The smallest ones are going to make their way down because they're going to be able to fit between and they're going to end up at the very bottom. Okay? So would that be handy for us to the smallest food fragments to be the smallest ones down here that we get to send across? And we leave the big ones up here to continue the digestion, right? So that's the kind of the way it's going to work. We're going to flop this around, move it around. The little ones are going to make their way down in between the bigger ones. We're going to test those first. If everything's good, we can start sending more and more and more into the small intestine. If we get to a point where no, that's not ready, now it can spend some more time. Okay? So we get different rates at which food are going to go through our stomach. Okay? It says the stomach is empty about 4 hours after the meal. Okay? So they do us usually even better than that. Okay? We don't want to aspirate during surgery, so they'll say oftentimes if you're going to have anesthesia or you're going to have some procedure done, no food after midnight, right? And that means it's past, okay? So there's no chance for you to throw up in your mouth, get it into your trachea, into your lungs, aspirate, that kind of stuff while you're under, okay? So that works well for us, okay? If it is a high carbohydrate meal, we can get that one through faster because the chemical breakdown's a lot easier for us. If it's a very fatty protein-based lipids and proteins. You go eat a bunch of steak, you go do a carnivore's night out, you do trail dust, all you can eat steak, okay? That's gonna be in there for a while, right? When you go to bed at night, it may still have a bunch of steak that you're having to process overnight in your stomach, okay? So, the more liquid the meal is, the faster it's gonna empty because it's kind of pre-chewed if it's liquid, right? You're getting a smoothie or something like that, that can make its way much faster through. We don't have to do the kind of breakdown, okay? And the larger meal causes us to produce more of the stuff, so we actually move large meals through pretty quickly, provided they're mainly carbohydrate, okay? So about 4 hours, okay?
So, you said, you talked about if you eat steak, it takes a longer time for it to digest. So carbohydrate digests faster than steak and
Yes.
lipids?
Yes.
Is it because carbohydrate turns faster into sugar faster?
No, it's just easier for us to break it down.
Oh,
Digestive enzymes work better and easier on the carbohydrates.
okay.
All right, so gastritis is when we have inflammation of the stomach wall. We've talked about hepatitis before. It just means that there's an infection and an inflammation there that can be through stress. Lots of things can cause this to happen. Gastric ulcers, that's a good story. We used to think, back in my day, the medications for ulcers went from Tums, Rolaids, all Pepto-Bismol was something that they gave for ulcers, that kind of stuff. They had to take this off the shelf. You don't hear these talked about as ulcer medications anymore because we realized that a bacteria was causing it. One of the doctors that was treating his patients for ulcers was giving rounds of antibiotics with the medications, and it started curing the ulcers. So they realized, oh, it's an infection in the stomach, and we identified it as Helicobacter pylori, pylori for the pyloric portion of the stomach. And what this bacteria does is it's normal flora in our guts. Most of us have it, okay? But under certain conditions where it might be stress, immune deficiency, something like that, it causes this bacteria to grow uncontrollably. And it actually erodes away at that mucus layer that is in the small intestine and in the stomach, which then gives access to the hydrochloric acid to burn our own tissues, okay? Causing basically a lesion there, an open wound in the stomach, okay? So, give a round of antibiotics. It's so common now, we can go to usually a doctor's office, and they make you breathe into a testing device, and it picks up enough of the Helicobacter pylori if it's present, okay? Because we do we can exhale from our stomach, okay, and get some of that air out of our stomach, and test it for these antibiotics, test it for this bacteria.
It's not clear. What you just said.
What?
Didn't get you.
The bacteria, there's a test that you can just do a breath test, and it identifies whether you have enough of it.
Okay.
Okay, then we've got vomiting. That's probably the greatest homeostatic imbalance we can think of in the stomach itself. And this is where there is a reason, oftentimes excessive stretching. If you eat too much, my dog will do this a lot. If she eats just a little bit too much, it will cause her to throw up, okay? And what happens when they throw up, we get it from the medulla oblongata, okay? From the medulla, we send information down, and we're going to communicate to the abdominal wall and the diaphragm to go through these contractions, this smooth muscle contraction that will increase the pressure in the abdominal cavity, forcing the food out, okay? Now, in order to do this, we've got to open up that pyloric sphincter, that valve in the stomach. It's going to allow it out. And the other thing that happens is that soft palate should rise in the back of our throat as this food is coming up, and it should block the entrance into the nasal cavity so that the food typically will come out your mouth. Okay? The vomit is going to come out your mouth. Although that doesn't work all the time. You can't have people that vomit. That was what that big open spot in the middle was. It was a dude that it was a very liquid vomit that he was doing, so you saw this big flow of vomit coming out the mouth, and then 2 coming out each nostril. It was quite impressive, okay? And it looked like it was probably alcohol-induced, y'all. It was a lot of fluid, okay? And that's one of the things that could cause us to vomit is excess alcohol, right? When there's too much, the medulla says we got too much toxins in the system. It's still present and we're absorbing them. We got to get them out. Okay, so the body will get rid of them. Also, if there are toxins in the food, if maybe the food at the buffet wasn't the right temperature and bacteria started laying these toxins on the food, creating these toxins, that's the food poisoning we see, right? Okay, when we get that kind of food poisoning, it's due to toxins in the food, not just the actual bacteria itself.
Doc, I have a question about
Okay.
that. So, we can't control the pyloric sphincter, right?
No.
So how can people make themselves throw up if we can't control that sphincter?
They're doing it through the abdominal contraction. They're taking, let's say, all of the symptoms of what the vomiting is. They're creating that on their own. Okay, they're leaning forward. They're causing the contraction. They're gagging themselves.
And that overrides the muscle.
Because it basically goes, I'm throwing up.
Yeah.
So it's pretty much the things we're throwing up.
So, sorry, was that question, was it that you can suppress the volume?
No, you can cause yourself to vomit. You can force yourself to vomit.
How do you do that?
You can gag yourself, increase the pressure here.
Okay.
You know, if you've eaten something, there's ways to get it out. And that's one of the types of eating disorders that there are, where people will binge on food, go to the restroom, get rid of it. What that disorder involves too is because the hydrochloric acid that's in the stomach has been moved back through the esophagus, there's oftentimes burning associated with this, and there's a greater chance for esophageal cancer in those patients that have this eating disorder because they've thrown up so much. And it's damaged, mutated their cells in their esophagus.
Why does it affect the heart though? I know it, like Karen Carpenter, you remember Karen? She suffered with anorexia,
Right.
right? But then she had a heart attack because
Because she had so little food source. She was so skinny.
okay.
Yeah. Okay. All right. From the stomach, let's move into the small intestines. Okay. 3 parts of the small intestine. First 10 inches or so, the duodenum, followed by several feet of the jejunum, followed by even more feet
Ileum.
in the ileum. Okay. They've got them in colors for us here, and you can kind of see the way they break out. Duodenum's going to be on top, jejunum in the middle, ileum down below. Okay? It's really hard for us to say exactly where that point is, where it changes from jejunum to ileum because it's so long. Okay? But each one of these 3 are important because they have different functions. Okay? Now, when we say the stomach wasn't the most important of the organs for the digestive system, I'm going to follow that with, now that we're at the small intestine, this is probably the one that we got to have. Okay? Because it says, plays a key role in digestion, that's still breaking the food down, and the most important role in nutrient absorption now, with 90% of things being absorbed in the small intestine. Okay? So,
Is digestion part of the mixing?
it's the chemical breakdown is the digestion part. Okay. So, duodenum, like I said, the first 10 inches, and we call it the mixing bowl. We're not doing a lot of absorption here. What we're doing is mixing what's coming from the stomach with and we're preparing it for being able to absorb it. So one of the things that we did in the stomach was produce a tremendous amount of hydrochloric acid. We got to neutralize this hydrochloric acid. Okay, so we got to buffer it. So we're going to have some buffers that are going to go along with this. Then we're gonna hit it with a tremendous amount of digestive enzymes to continue that digestion part, okay? We're just getting started good with digestion, okay? And as y'all know, we don't do a great job of digesting certain things, right? We've all looked in the, if you've ever eaten a bunch of corn on the cob or something and looked in the toilet afterwards, there's corn in there, right? We don't break that down very well, okay? My dad, in order to make sure that his feces are able to move out of his body real easily, he takes Metamucil, which he says are ground up corn cobs. That gives his feces bulk, okay? It bulks it up, it makes it easier for him to get rid of this, okay? It's not adding to his diet. We say it is, the calories in that are not something that we're absorbing. It's just there to bulk the feces, okay? So, we're gonna mix what's coming from the stomach with digestive secretions from the pancreas and the liver. This is the mixing bowl, okay? And then we're gonna go to the jejunum. About 8 feet of jejunum, so 10 inches, and then 8 feet, and then 11 and a half feet, okay? Then we got plenty of time to absorb it, okay? So that's where more absorption is gonna be, okay? One of the main features that we see here, okay, if we are going to increase the absorptive surface area, that's gonna make us take in more nutrients, right? Just like we did with the respiratory system. Okay, one of the things that we worked on is let's get a huge surface area. And we said that both lungs together made up 35 times that of the body, right? Okay, so we want the same thing here. And we're gonna go to even more excess here. This is everything that we can get out of our food going into our bodies so that we can use it to make energy, right? If we don't do this well, we're not gonna have enough building blocks to make the things, nor are we gonna be able to have enough energy. So we gotta do this well, okay? So let's just increase surface area. The worst surface area, surface to volume ratio, is that sphere. And that's the shape that our tube is in, right? This is the same shape that these small intestines are in, okay? This sucks. We have got to do better than this. So how can we increase the surface area? One way is to put these big hills and valleys there that you can see, okay? Cut into the intestines, you can see these plaquae, okay? They're called the plaquae circulars. They are big speed bumps on the inside, okay? Let me take you back because that doesn't even do it justice, okay? This looks like they're just little speed bumps. This is what they really look like, y'all. They're almost like flaps in there, okay? So there's flap after flap after flap after flap, which means instead of it being this circle like this, I've got all of these flaps in here, each flap having an absorptive area on this side and an absorptive area on this side. It's resting on this little piece right here, right? And then there's another one right behind it, another one right behind it. So I get tremendous surface area now, okay? But where do we need this? We don't need them so much in the jejunum. We need them a lot more, in the duodenum, we need them more a little later. Okay, so we're gonna find them in the jejunum. And that's why it's showing us jejunum there.
So you said these absorb nutrients, or do they help push food down through the intestine?
Now, this is all about absorption,
It's all absorption.
You mean the duodenum,
not in the duodenum.
the plaque?
The plaquae are not found as in that many numbers in the duodenum, much more so in the jejunum and cilium. Because that's where absorption's gonna be,
You
right?
have more.
Right, that's where absorption's gonna be. Okay, so the plaquae are there. So how can we increase it more than that? On each one of these flaps, let's put a bunch of fingers, the villi. Okay, let's put the fingers, the villi. And that's what these are gonna be. Okay, so y'all can see all these little fingers sticking off, going up, down like this. That's these. Okay, is that gonna increase it even more? Yes, we get tremendous. I can absorb from any part of this finger all the way around, right? So I get a lot more surface area here, okay? Then how can we do it one more time? We know there's one other way to do it that we learned back in AMP 1. We can put structures on the outside of the cell that are little fingers called microvilli, and that will help increase the absorptive surface area of that individual cell. So, I like to think about it this way. We've got this, on the earth, instead of a flat spot on the earth, we've got a big mountain. And on the mountain, we've got a bunch of pine trees. That's the villi. And on the pine trees, we've got a bunch of pine needles. That's the microvilli. And all of that is able to be absorptive now. Okay? So we get a tremendous surface area for absorption here. Okay? When we look at it under the microscope, we can see these plaques. We can see these villi sticking off. Okay? And we can see that they go through a change as they move down the length of the small intestine. So that's the villi. Okay? Which is the finger. And notice that this villi has underneath it, in its lamina propria, which is that connective tissue that's going to be supporting it like a finger, it has a blood supply, has an artery and a vein going to it, right? So that's where we can pick up stuff. That's a capillary bed. We can pick stuff up from the absorption moving into the bloodstream right there. What's the yellow thing going through the middle? That's the lymphatic vessel. That's that lacteal we talked about, the lymphatic capillary. What are we going to put in the lymphatic capillary?
Water.
Lymph?
It becomes lymph once it gets in there.
This is where we have to transport fats as well. It was a place that we can transport lipids.
Lipids.
So the proteins and the sugars are going to end up in the bloodstream. The lipids are going to end up in the lymphatic system, in that lacteal, and get sent back and dumped in up here, right? Okay. And then we've got the simple columnar epithelium that you see going around, with each one of these big white spaces being a goblet cell that's going to be mucus production. Okay? The rest of these are all simple columnar epithelium with, you can call it a brush border because that means microvilli. Okay? Okay. So the goblet cells are found between our columnar epithelial cells. They're going to eject the mucus onto the surface so that things slide along very easily and give us a place for absorption to occur. So in the duodenum, we don't have that many plaques. It's not about absorption here. It's still about chemical digestion. Okay? Still about chemical digestion. So we're getting they call it chyme, C-H-Y-M-E, where it used to be a bolus of food that we swallow that makes its way down to the stomach. Once it becomes this liquidy mass, it's called chyme. Okay? So what we throw up is chyme. Okay? Because you can't look at that chyme and go, that is one mouthful of food, right? From our stomach. It's all mixed together now. Okay? And that's what we used to say. You know, I have friends that when they eat all of this first on their plate, and then they move and they eat all of this next, and they eat all of this. And they don't want their food to touch. Y'all can't have your food touch? Everybody's okay with that? Oh, Nolan's a little, yeah, okay.
Certain things.
You know, and my dad, it's all going to the same place, right? Let it touch, mix it all together. And you see people, I can't do that. Ooh. Okay.
I know it all goes in the same place, but when I'm eating it, I do one at a time.
Okay. That's good to know that.
The chyme now, does it help in digesting the food?
Yeah, it's in fluid. So now that
So
it's
is
in
it a
fluid,
kind of enzyme?
well, it's got enzymes in it, but it's got a lot more fluid in it now. Okay? And I was talking about the difference between humans. We drink while we eat, right? We drink, okay, iced tea, or, you know, we said Lacey drinks wine with her meals because, you know, but
Old fashioned.
our throw up tends to be a lot more liquidy then my dogs throw up, right? Okay, when Maisie goes over and eats, she eats dry dog food, and she doesn't go get a drink in between. She just sits there and rah, 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 rah. And if she eats too much when she throws it up, it looks like a bunch of dry dog food there that's a little moist now, right? Just a little moist. You can pick it all up with a napkin. It doesn't run all over the place.
You would be surprised. I work at a dog daycare. It's disgusting.
Yeah, I understand. I understand. But it's not usually as liquid as ours, okay? So in that duodenum, we're gonna have very few plaquae, and we don't need a lot of villi. So the villi are small, okay? Because we're not doing a lot of absorption here. We're doing a lot of mixing. We've got the chyme coming in, and we're going to mix from what's coming in from the stomach with what's coming in from the pancreas and the liver and gallbladder. Okay? So what we've got to deal with first is neutralize the acids. Neutralize that hydrochloric acid. Okay? And luckily we've got a pancreas that will do that. It will supply some bicarbonate, and we will neutralize it. That same bicarbonate we talked about being the buffering component of the blood. Okay? So we're going to neutralize the acids from the stomach. Okay? And while we're here in the intestines, let's add a lot more water. If we hadn't added enough, now let's add even more. Another 1.8 liters per day into the intestinal lumen. Okay? This is going to make it even more watery, make it easy for things to stay in solution though, right? Easy to stay in solution. We're going to be able to move it around very easily. It's not very thick, so it's going to be able to move very easily. It's going to help moisten the chyme. We're going to buffer the acids there. It's going to keep everything in solution. Remember back in A&P 1, we said we're a big wet lab, we said. It's all about water, and these chemical reactions need to occur in water. That's what's happening here. We're making sure there's plenty of water, and that way we can continue to stir it. And if we stir it, is that going to make the chemical reactions go faster? Yeah. Yeah, and we're operating at 98.6 degrees. Is that going to help? Yeah. Warming all this up, right? So when we throw it up, that throw up is 98.6 degrees if it's been in there long enough, right? Okay? So it's nice and warm, plenty of water for everything to come in contact with everything it needs to, and we keep everything in solution. And the peristaltic contractions that are happening with our circular and longitudinal smooth muscle are keeping it mixed. They're squishing it along. As it's moving, it's like it's in a little creek. It's being forced across the little rocks and pebbles and stuff, and it continues to just mix and mix and mix, and the enzymes are able to come in contact with the food that they need to break down over and over and over again.
Why like in reptiles, some reptiles will swallow rocks and stuff like that?
More so birds like to do that. They actually have a structure called a gizzard.
Yeah.
That they hold the rocks in. And while they eat the grains and things like that, they use it like a pulverizing mechanism. It's a muscular gizzard that has the little rock. In fact, you can see it eating the rocks. Side of the road a lot of times. And people, you can go to a bird shop, one of those highfalutin bird shops somewhere where they'll sell you rocks to give to your birds, y'all. Ain't like there's a shortage of rocks. Don't waste your time buying rocks for birds, y'all.
So, wait, I thought they eat rock, I thought the rocks go to their gizzards, or?
What's their gizzard?
My girlfriend's dog eats like rocks and grass.
Now, dogs don't have a gizzard.
I know that, but like.
That's not how fat they are.
Yeah. Unless it has feathers, then we may need to talk about
So,
her dog.
But like some animals do eat that, for like, to help digest whatever is going on.
Grass, more so, usually that helps with an upset stomach, that kind of thing. It also helps move things through pretty easily. So there's different things that will happen.
That'd be the same essentially like cats, like whenever they eat grass and stuff like that.
No, I'm taking antacids.
I thought dogs throw up.
They can. It's part of that could be that they're trying to throw up.
And gross,
Yeah. But there's other ones that like my dog likes to eat hackberries, but little hackberries, because they're sweet. And she won't throw those up. It's like, it's kind of an acid type for her. So, and I read something about that, about Native Americans using it for that kind of purpose. And I said, look at my dog, being all smart, when she's not, okay?
I will say, my girlfriend's dog eating rocks, there's no rhyme or reason why.
Well,
No. I don't know, so.
all right. We're doing good. Pancreas, our first, our
Please, you know when you showed us the slide of the intestine, we saw the duodenum, then we now saw the duodenum, the large intestine, we saw the ileum, what's the jejunum?
the one that I showed you in lab was just a jejunum.
No. The one you showed us here.
Okay.
We have the duodenum, we have the jejunum and the ileum.
Mhm.
In that slide, we didn't see the pancreas. Was that deliberate? Because in this slide now, I'm seeing the duodenum and the pancreas. Is that how it is in the human form?
Yes.
Can you go back to that slide where you have?
I don't know which one you're.
There's this slide where you showed us the duodenum, the ileum, and
That one?
Yeah. So here, where is the pancreas on this?
Well, it's not shown here, but it's going to be tucked in right here.
Oh, okay. Okay, that's all right.
Okay. So our first accessory organ, and by accessory, I mean it's not part of the tube. We're gonna have a duct that sends things into the tube. So it's sitting outside the tube, but it's got its own little connection to the tube, okay? Salivary glands were the same way. They had things that went into the tube, okay? So the pancreas's job is, and we should say we don't live without a pancreas. It's not one of the things that we can live without. And that's why pancreatic cancer is so much of a problem, okay? It tucks in as the stomach moves food from the stomach through that pyloric sphincter into the duodenum. This 10-inch area right around it, okay, has the head of the pancreas that kind of tucks in. And it's all found in this connective tissue that's holding all this together. There is a little hole here called the duodenal papillae that this duct that runs through, it looks kind of like a fishbone going through. It makes its way in from the pancreas through this little hole. Okay, now we go ahead and join from the liver the common bile duct using the same hole that we just have one to worry about. Okay, but the goal here of the pancreas is to produce things to continue digestion, also continue to buffer that hydrochloric acid. Okay, so lots of digestion. In fact, most of the digestion is coming here. When we look at it in lab, we will see that these cells out here are the ones that are producing the digestive enzymes for us. We call these the acini cell. And there's a lot more acini cell than there are these little peppery patches called the islets of Langerhans or the pancreatic islet. Call it either one. Okay? This is the endocrine factory. This is the exocrine factory. Exocrine for sending the enzymes through the tube. Endocrine, sticking it into the bloodstream. And what we're sticking into the bloodstream is insulin and glucagon. Okay? And what this is going to do is maintain our blood sugar levels in the body. It's going to maintain the homeostasis of blood sugar. Okay? And this shows you kind of where it's at. Right here. Here's the stomach. And then right off the stomach is that duodenum coming around, and you see the head.
So all that transpires within the pancreas.
Yeah. Okay, so head of the pancreas here, stomach above it, spleen's typically over here on this side. It has three parts to it: the head, the body, and then the tail. And it kind of tucks in, the head of the pancreas tucks into the duodenum. head, body, tail. Pancreatic duct, sometimes you hear it as the duct of Wirsung. I don't care, call it the pancreatic duct. That's easy. Okay? It's delivering the enzymes and the buffers to the duodenum. Okay? We're going to get the pancreatic duct attaching with the common bile duct that comes from the liver and the gallbladder. That's what this is showing us here. The green is always talking about the bile coming from our liver and gallbladder. The pancreatic duct is coming underneath it. They join together in a room called the duodenal ampullae. And there's a bunch of smooth muscle that wraps around it so that we can release it and allow for it to come in, or we can constrict it and not allow anything to come through. So they call this sphincter the hepato for liver, pancreatic for pancreas, sphincter. Okay? And we're going to work them together. We're going to work bile release and pancreatic duct release, okay, at this sphincter.
So both of them are released and can you go back to that slide, please? So both of them are released and it gets into the duodenal ampullae, is that what you're saying?
Mm-hmm. And then into the duodenum over here. So that's how it gets into through the papillae.
The bile duct is to, I think it's to break down fats, right?
Bile is to help emulsify the fats.
Emulsify that. Then what about the pancreatic duct?
It is all about digestive enzymes. Okay, so when we look at it on a slide, we'll see areas like this that would be the pancreatic islet. And I know it says islet there, but everybody says islet, y'all. So that's one of the pancreatic islets. All this out here would be Acini cells. Okay, all this is Acini cell. That looks like another islet to me right there. Lots of Acini cells.
So
Okay?
all that surrounding the islet is the Acini cells, is that what you're saying?
That's what I'm saying.
I have a question.
Uh-huh.
What, do we just need to know that the Acini cells secrete digestive enzymes, or is it like a specific?
It's coming up. We get specific about it.
Okay.
So endocrine cells, that's insulin and glucagon, okay? And when we think about insulin and glucagon, insulin is what causes the blood sugar levels to decrease. Okay, when we release insulin, we're telling the body that we've got too much glucose in the bloodstream. We need to store it in the blood, or store it in the tissues, store it in the tissues. Okay? Likewise, if we get scared to death, we need to release more blood sugar so that we can run away, right? Okay? So, that would be glucagon's job, okay? And one of the things that I can do with my wife, since my wife lost her insulin producing cells in her pancreas, she wears a monitor that is giving constant feedback as to what her blood sugar is. Now she's eating, and she'd be mad at me showing y'all this, but right now, what's normal is about 100, right?
100.
Well, 100 is normal. Somebody with diabetes, that's what they're looking for, 120. Okay, so 100 is really about where you want to be with your blood sugar levels, okay? So, her monitor goes off if she falls below 80. That means she's getting too low, and she gets where she doesn't have enough sugar in her bloodstream, which means she could pass out. And then it'll also go off if it gets above 320 for me. And right now, it went off earlier, so she's at 321 right now.
Toast to something in the morning.
Well, and that's what I was going to tell y'all this story. I noticed my wife, back before COVID, when my wife would fly, I would see her blood sugar go up. She'd be on the plane, she'd say, okay, aboard the plane, I'll call you when I get there. And I'll be like, okay. And her blood sugar would go up. And I would always be like, is she drinking? She had a drink. What did she eat, you know? And she'd get done, and I'd say, what did you have to drink? She didn't have anything to drink. I had Diet Coke. I was like, well, your blood sugar went up, you know? But if you watched it, and when she called me, when she landed, it also went up right before she called me. So her blood sugar was going up when she was taking off and when she was landing. You know what that was, y'all? She was nervous. She was nervous when she was taking off, right? And nervous when she was about to land. So her blood sugar levels would go up because glucagon would get released, and she would dump a little extra in case she had to, fight or flight, right?
Yeah.
Which kind of made sense. I was like, that's cool. So then I started messing with her at home. Like after we had a fight, I'd go look and see how high I got, just to know. I'm trying to use that as a gauge on how much trouble I'm in a lot of times, right? If you get her up to 200, I've decided that's not good, y'all. I'm in trouble for a while, okay? So, all right. So this pancreas is gonna also, remember we had 1.8 liters being released from the intestinal juice, right? Just the intestines releasing it. Pancreas is going to release another liter over the course of a day in fluids. Okay? As long as we're eating correctly. This one's much more dependent upon what's going through. Okay? And again, it's going to be controlled by hormones from the duodenum, which means when food hits the duodenum, that's when we need the pancreas to do its job. Not before, right? There's nothing there. We only want it when there's food there. So when food hits it, now let's communicate to the pancreas, tell the pancreas, got some food here, we need to buffer it, we need to hit it with a bunch of enzymes, okay? Neutralize, okay? So, these digestive enzymes are tons. Every type in the book, y'all. From carbohydrases, lipases, proteases, peptidases, all of them, y'all. So we get a ton of enzymes. So when we say, okay, what enzymes are being released, it's easy to say all the different kinds of digestive enzymes. And that pretty much covers it, right? But I want y'all to pay special attention to the one at the bottom where it says proteolytic enzymes. We hadn't done a whole lot with proteins. We hit it with pepsinogen or pepsin in the stomach. This is where we're really going to work on the proteins. Okay? We're going to really work on the proteins here, and the pancreas main enzymes that it produces are proteolytic enzymes. Yeah, we get some carbohydrases. Yeah, we get some lipases. Yeah, we get some nucleases. But 70% of all pancreatic enzyme production deals with proteins. So our pancreas in humans is really helping us break that protein down, right? Really helping us break the protein down. They are all secreted as inactive proenzymes, which is what pepsinogen was that gets converted into pepsin, which is what fibrinogen was that gets converted into fibrin. They all get released this inactive way. When they arrive, that chemicals that are present convert it, okay? Help convert it to an active form of it, okay? Even the zymogen we were talking about with the complement system, okay? It's inactive until something causes it to be activated. Then we got the liver, okay? Then we've got the liver. Liver, largest visceral organ, which means largest organ in our abdominal cavity, right? It's the big one. Inside of us, it's the largest organ. They say, what is the largest organ of the body? I want to go skin, okay? But that's really an organ system too, okay? So you have to be careful with the way they ask that.
What did you just say? Sorry, I didn't get it.
The skin is also considered an organ, but it's also considered an organ system, okay? And it's going to perform, this liver, I said, if you don't know the right answer and liver is an option for you to guess, always guess liver. Because when we look at this liver, it does so many things for us, okay? It's got a tough capsule around it. It's divided into lobes. It's got 4 lobes, just like the cat had that we looked at today. We got the right lobe, the left lobe, the caudate lobe, and the quadrate lobe. So the caudate lobe is up above. It's the one up high. The quadrate lobe is down below, near where the gallbladder is, that little green sac. There's a falciform ligament that separates the right and left lobes, and also attaches it up to the diaphragm, attaches the liver up to the diaphragm. Okay? Caudate lobe up above, and quadrate lobe down below in the center. Okay? The goal for the digestive system, when I say what does the liver make for the digestive system, the answer is bile. Okay? It's going to make bile. And what does bile do? Bile emulsifies fats. Well, what does emulsify mean? It breaks them down into little bitty droplets. It goes from being a big fat glob to tiny little droplets. Okay? And the way it's set up, where the bile is made in the cells of the liver are called hepatocytes. They're going to make the bile, and y'all remember how the bile is made because the heme group got sent to the liver, right? We did the bilirubin, the biliverdin first, the bilirubin, and then into bile. Okay? So this bile that's made gets sent through a bunch of little bitty channels called canaliculi. Remember in the bone we had those little, so it's the same kind of thing, bile canaliculi. And then they go through, I like to say, ditches into streams, streams into creeks, creeks into rivers, rivers into bigger rivers, right? And that's where we end up at the duct systems, okay, the bile ducts. We get a right and a left hepatic duct. So the main river flowing out of the right side and the left side lobes, okay, are the hepatic ducts. Right hepatic and left hepatic duct. And they're going to come together, fuse, and form the common hepatic duct. Remember how our muscles and how our bones would, or how the blood vessels did that, right? The external iliac and the internal iliac form the common iliac, right? Same thing here. Put these two together, we've got the common, okay? Common hepatic duct, okay? And now the common hepatic duct is going to leave the liver, okay? And as it's going down, there's going to be a side road off of it, a side duct off of it called the cystic duct that's going to lead to the gallbladder. Okay? And since we got something leaving off of it, we got to change the name from there on down. We're going to call it the common bile duct. Okay? So I'll show you a picture of this. Okay? So this shows us, here's the right side, right hepatic duct, okay, coming out, left hepatic duct coming out, where they join together forms the common hepatic duct, okay. Then there's this side road that leads to the gallbladder called the cystic duct. From the cystic duct, where the cystic duct comes off, everything from here down to the duodenal papillae is the common bile duct, okay? So a lot of individuals have to have their gallbladder removed if there are issues with the gallbladder, that maybe they're making stones, there's different reasons, okay, infection, that kind of stuff. So it makes sense how we can do this, y'all. We go in, snip the cystic duct, peel this off, suture it right there. Do I still get bile production from the liver? Yeah. Do I get as much? No. And I used to have to ask that question in class back in the day when they did gallbladder surgery. I'd ask, did they tell you to change your diet for a little while? And it was kind of 50-50. Okay? And as I've taught, the longer I've taught, the more people have said to me, yeah, I was supposed to kind of cut my fats down the first year or so. And that's true. eventually the liver will start producing more bile for you now that you've lost that gallbladder. Okay? So,
But you said the liver produces the bile, right? The gallbladder,
just stores it and concentrates it.
okay, so if the gallbladder is removed, it shouldn't affect this, the production of the bile, right?
The only thing that is limited is your ability to have a really fatty meal on the front end. So immediately after surgery, your liver has not increased production, so you don't have that extra shot of really concentrated bile that if you went and ate at Long John Silver's and had the captain's platter with extra crunchies, you know, the little crunchy batters that are fried, right? And you had a bunch of French fries with it, and you say, hold the coleslaw, give me more French fries and crunchy things, right? And my hush puppies are a little cold, go ahead and throw them in the fryer too, warm them up for me. We got some fat going on now, right?
Sounds like you ordered that already.
In, right?
Wow.
Okay, so we're not gonna handle that very well, okay? So if somebody loses their gallbladder and doesn't change their diet, what happens is that fat is not emulsified. It stays as fat in your intestine. We don't absorb it because there's too much of it, and it ends up coming out the large intestine, which hooks to the rectum, which hooks to the anus. And I had this was a problem for a friend of mine. She got her call. It's a great story though. In graduate school, she was from Idaho, first of all. Okay, she's from Idaho, and she was kind of shaped like a potato. You know, you think about
Oh my God.
She would say, I'm not. Okay, she was chunky and lumpy like a potato. Okay, and when we would go eat, so when I was at Memphis, there was a $2.99 lunch special that you could go over and get, and it had a meat, a couple of vegetables, and a bread. Okay, and it'd be like fried chicken, mashed potatoes and gravy, broccoli, and a roll. Okay, $2.99. It was good. Okay, so a lot of us would go over there and eat in the cafeteria. She would go over there, and I'm not lying, she would get an order of French fries and a bag of Lay's potato chips. That was her lunch. Okay, she didn't like vegetables. She liked potatoes, and her body had taken on that shape of her liking potatoes. Okay, so she had trouble with her gallbladder. They took her gallbladder out. She didn't like other food, y'all. Did she change her diet? No. So what was happening to the fats that she was eating was coming out the other end, which made her lose a bunch of weight. She went from being chunky to very thin, got her a boyfriend, y'all, married that rascal in graduate, the same boy, the boy, okay? Married him, they got kids, right? And she told my wife, she said, my toilet paper bill has went up so much because it's all greasy. And that's why, because my wife was worried about her losing all this weight so fast, okay? But she said, yeah, we got to talking about the gallbladder and that kind of stuff. So she's still a little bitty now to this day. Can't stand her, okay? All right, that's enough. I'm gonna stop here. We'll pick up here on that day after tomorrow.
Thank you.
Yeah, that day. You're looking at us.